Okay, good afternoon. After 6 months of this pandemic, I understand how people feel exhausted with thinking about it and coping with its impact. We're not yet able to make COVID-19 a part of our past, but we have a lot more clarity about how we can get to that point. Today I want to talk with you about the direction of our country over the next 6 months. This is not just about how we will live with the COVID-19 virus, but also how we will work to renew social, economic and cultural life. 6 months ago, the world was confronted with a dramatic new pandemic, about which we knew little more than the fact that it was deadly and rapidly spreading. As our schools and workplaces closed, people didn't know what to expect. We all felt fear and uncertainty. Through a collective national and international effort, the virus and its impact were first controlled and then reduced significantly. Ireland, just as other countries did, began a process which intended to reopen activities in stages. But as we moved through the summer and away from the lockdown period, something became very clear. The threat posed by the virus continued to change, and policies had to change in response. We understand the frustration which people, and businesses in particular, felt when limits were kept in place or introduced. But without this action, we would have seen even higher levels of infection than we currently have. At the same time, our country has been able to achieve some really important progress. Schools have reopened in one of the most complex policy and logistical challenges they have ever faced. And we're all delighted that our children are back playing in the schoolyards. The economic stimulus package is making a very real difference. We still have a way to go before we fully recover, but just for example, in the last 11 weeks, over 200,000 people have been able to come off the special pandemic payments back into work. Taking account of all COVID-impacted jobs, the unemployment rate has fallen from 23% to 15%. Most of all, we have been able to reconnect with our families and friends and to once again experience our own country. Until there's an effective vaccine and it has been widely administered, we must continue to live with the reality that COVID-19 is potentially deadly, causes long-term illness, and we must limit its spread. When the vaccine is available, we will move quickly to implement a widespread vaccination program. However, I want people to understand that even before then, we can go much further in opening up economic, social and cultural life in our country. We can do this if we work together in implementing the comprehensive plan which we're launching today. This is a plan which gives clarity about each of our responsibilities and how different situations and sectors will be handled. It includes concrete measures which address both well-established and emerging issues. It shows how we can limit the impact of the virus while keeping our schools open, protecting and expanding employment, reopening services and supporting social and cultural activity. This plan truly represents a whole-of-government approach. And I want to thank everyone who has contributed to it, and in particular I want to acknowledge the work of the public health professionals and all frontline staff who have done so much for our country. The plan is broad and comprehensive, but it has 3 core pillars: protecting health, strengthening employment, and supporting communities. Underpinning this is a new approach to the ongoing management of the COVID response and clarity for people about what will happen in different scenarios. Protecting public health remains an absolute priority. The plan sets out the clear public health guidance which we should all follow. We must never forget the fact that the virus is still here and each of us has a personal responsibility to try to limit its spread. This new phase involves the introduction of a new framework for restrictive measures. There will be 5 levels of response to different levels of threat from the virus. Currently, every county is at level 2 restrictions. Our collective effort is required to get to level 1, while we wait for a vaccine to be developed. There will be a heightened system of monitoring and enforcement to guide this rapid and targeted response to outbreaks. And we will move decisively to address the fact that there are other health concerns which must be addressed. The Government has decided today that the existing public health restrictive measures, as amended in line with the new Level 2 framework, will be continued for a further 3-week period. The current COVID numbers in Dublin are very worrying, and the Government has also agreed today to introduce additional measures based on the recommendations of NPHET to suppress the spread. And I would say to the people of Dublin and indeed the country, rising rates of infection can be reversed by concerted public action and by all of us adhering to the guidance and taking this personal responsibility. Today the Government also crucially approved a €600 million winter initiative package to develop and protect our health services through what will be a very significant period of challenges up to next March. This plan shows how we will strengthen also business and employment as we live with COVID. Key business supports will remain in place until March 31st next year. The pandemic unemployment payment will now be open to new entrants to the end of the year. And a series of local activation measures will be put in place. There have been no restrictions currently on persons coming into the country, as we do need to keep travel routes open in order to stay connected and to keep supply chains open. The Government has decided to broadly support the European Commission proposals on travel as the best way of achieving this. So we will continue to engage with Member States and the Commission to finalise an approach which is consistent with public health requirements while supporting our needs as an island. In the interim, the current Department of Foreign Affairs Travel Advisory Normal Precautions list will be updated in line with this new proposed European framework. The third pillar of the plan is about helping our communities. Local well-being initiatives will be supported. And we all recognise the role of sport in building our sense of community. The Government has agreed to allow limited crowds to attend sporting events under specific conditions. During this pandemic, the absence of live arts and culture events has reminded us again how important they are to us as a people. Creativity has never been as important, and we understand the huge impact which has been felt by all who work in the arts sector. This plan allows access to theatre, cinema and music events in small, controlled settings. There is simply no doubt about the negative impact on mental health of this pandemic, and the plan proposes to implement a national approach to increase mental health supports. Underpinning the measures in this plan and the new framework for deciding on restrictions will be a revised decision-making procedure. NPHET will remain as the key body providing public health advice to government. And I want to say once again how much I value the work of NPHET and the urgency which they show at all times when seeking to protect the Irish people. In addition, a new group chaired by the Secretary-General of my department will coordinate proposals for acting on public health advice and implementing measures, and permanent coordination between departments will be enhanced. This is a comprehensive and detailed plan for how we will respond to the ongoing threat of COVID, limiting its deadly impact and allowing us to move forward as a country. It puts in place a framework for rapidly managing outbreaks when they occur. It shows how we can restore more of our economic and community life. It sets out our determination to strengthen our country's recovery. During the pandemic, there's been a lot of reflection about our resilience as a country, because COVID has had many sides: medical, social, economic and cultural. And it's only human to feel deeply the downsides, the deaths of spouses, relations, friends, many in the harrowing circumstances of being isolated from their loved ones at the end of their lives. But it has one great positive side also. It has probed and tested our personal and national character day after day, week after week, over 7 long months. But it has found no weak spot, no failure of nerve, no lack of courage, either in our people or in our society. We have overcome much bigger challenges in the past and will also overcome this challenge. Because resilience isn't just about standing strong in the face of a challenge. It's also about knowing what you value in order to protect it. It's about being flexible, and it's about working to build back better and stronger than you were before. We have set out a clear plan for the next 6 months when we will both manage the virus and continue to rebuild key services and supports.
Thank you, Taoiseach. 6 months ago, I first spoke to you about the coronavirus. Since then, we've been through a lot as a country. There have been days of fear as well as days of hope, reasons for optimism as well as days of suffering and loss. Although some of the faces delivering the message may have changed, the essential message remains the same. By doing the right things, we can protect each other. From the beginning, we knew we were in this together. Now we need to know that we can get through this together as well. I know many people are feeling frustrated, impatient, even anxious, and we all want to be able to plan our lives. And so many of our livelihoods depend on having certainty about the future. Unfortunately, nothing is certain about COVID-19. It cares little for our plans. However, we have reasons to be hopeful as a country. We're guided by all we've learned about the virus in the past few months. And we have confidence that we can do this because of what we've learned about each other. We've changed the way we live, the way we work, and today's plan sets out steps to keep the virus under control, how we can anticipate and understand how to live our lives for the next 6 to 9 months. And where setbacks occur, the steps that will be taken to reduce the risk of COVID-19 spreading out of control. So this is a plan to protect you, your family and friends, our community, our jobs and businesses. Throughout this pandemic, Irish businesses, large and small, have shown remarkable grit, resolve and adaptability in the face of unprecedented challenges. Business models have changed, premises refitted, staff retrained, people are working from home. And all of us do understand the deep concern that business owners have about the potential of business failure. So economically, our focus is to help businesses to open, stay open, to keep staff on and customers safe. And the government has and will continue to back enterprise and protect workers as best we can. As you know, we're backing business with wage subsidies, targeted tax breaks, cash grants, low-cost loans. And where local restrictions have been put in place, government has responded and will again. In the budget and the National Economic Plan, the government will review existing financial supports for business, paying particular care and attention to businesses mandated to stay closed and sectors that have been disproportionately affected. Recognising the impact on workers of future business closures and local restrictions during this pandemic, the pandemic unemployment payment will not be closed to new entrants as had been planned, nor to those sadly laid off for a second time. For most of the country, today brings some good news. In 25 counties, pubs will open on September 21st. 50 people indoors and 100 people outdoors will be able to gather in controlled environments, 200 in large stadia. For one county, it's a little different. So I want to make a special appeal to the people of Dublin. The situation in our capital is worrying and has deteriorated in the past few weeks. The level of the virus circulating in our city and county has increased more than tenfold in the past 2 months. The positivity rate is around 3.5%, against around 2% in the rest of the country. If this continues, it may not be possible to keep the virus out of our hospitals, nursing homes and factories, no matter how hard we try. We'll experience a second wave of hospitalisations, people needing admission to ICU, and sadly more deaths. Perhaps the virus has become less deadly. Perhaps we've just got better at treating it and at shielding the vulnerable and the elderly. Perhaps, as some speculate, a second wave will be much less serious than the first. But speaking as a Dubliner, I don't want us to take that chance. So for the next few weeks, we're asking people of Dublin City and County to take particular care and to follow what are essentially the 4 W's. Not to welcome any more than one other household into your home, and the same applies to when you're socialising outside of it. To wash your hands. If you can't remember how many times, or if you can remember how many times you've washed or sanitised your hands today, it's because you haven't done it enough. To watch your distance, to try to keep at least 2 metres apart from people at all times as best you can, and where that's not possible, to wear a face mask or a face covering. This is September, the month in which Dublin usually shows the country what we're made of, and that's what we have to do now. We can flatten the curve in Dublin again, and in doing so, protect the rest of Ireland from its spread. Last spring, when faced with an unprecedented crisis, we came together as a country, and we were at our best. Today's ask from government is even harder. We're asking people to see this through to the end, however long it takes, no matter how heavy the burden, and to do this for each other. Thank you very much.
Thank you. Stephen?
Thanks, Taoiseach. We've been dealing with COVID for 6 months now. Chapter 1 was about closing the country down in order to flatten the curve, and we did that. This is Chapter 2, and Chapter 2 is about keeping the country open by suppressing the virus. And that's what this roadmap is about. It's about reducing the ways the virus spreads in order to protect lives, in order to protect health services, in order to keep schools and colleges open, and in order to protect many, many jobs right across the country. It's been a really tough year for so many people, and during times of worry and fear, we come together. But because of COVID, physically we've had to stay far more apart than we want to. But we have nonetheless pulled together, cancelled plans, put milestones on hold, done the shopping for our neighbours, used new technologies, run clubs and run businesses differently in a world with COVID. What this time has proven again and again is the strength and the resilience of the Irish people. Our healthcare workers have been quite extraordinary. They've worked tirelessly in recent months to care for patients and to keep health services open. GPs have done amazing work in our communities. Our doctors, our nurses, our allied healthcare professionals, and everyone else who works across the system has stood up when their country needed them to most. But nonetheless, COVID is continuing to have a very big impact on our health services. It's now taking us longer and costing us more to do less. And because of this, this winter poses the biggest challenge to our healthcare services in living memory. In response, the government this morning agreed to an additional winter support package for healthcare for €600 million. A detailed plan will be launched in the coming days, but what I can say now is that the winter plan has been designed along Sláinte Care guidelines. It aims to do 3 things: to care for people in the community as much as possible, to add capacity to our hospitals, so for those who need to go to hospital, they can be treated as well as possible, and to provide pathways back into the community and back into the home for those who are discharged from hospital. Measures will include more home care hours, community specialist teams, access to diagnostics for GPs in the communities, community assessment hubs for people with respiratory issues to keep them out of the hospitals, additional beds, critical care beds, hospital ward beds, rehab beds, and community beds. Critical services, including cancer screening and cancer care, will be supported. The flu vaccine will be distributed very widely and for free to all at-risk groups, including children under 12. Several thousand people are now being hired to run the testing and tracing system which we're going to need through the winter. Yesterday, the head of the World Health Organization warned that Europe is facing a very difficult time in the coming weeks and the coming months because of COVID. Today's roadmap gives us a way to navigate that very difficult time. Because of the efforts of the people of Kildare, Laois and Offaly, we now know that when we follow the advice of our public health doctors, when we move quickly and when we move locally and when we work together, we can suppress this virus, we can reopen businesses, we can reopen society. In the coming months, that's exactly what this roadmap is going to help us all to do right across Ireland. Thank you.
Okay.